Lung cancer is the second most common cancer in men and women. How well do you know the signs to look for, or even would you be the one at risk? To talk about that and the importance of early detection for lung cancer, with us today is Dr. Mohamed Mohamed, Thoracic Medical Oncologist with Cone Health Cancer Center and an expert in the lung cancer field. So I'm sure, people think they're at home tonight and they're thinking to themselves, well, I've never smoked before, so I'm sure I'm not going to be someone who needs to get tested for lung cancer. But let's talk about who is at risk for lung cancer.
Thank you, Tanya, for having me again to talk about lung cancer during the Lung Cancer Awareness Month. Any one of us is at risk for lung cancer, and we always say that if you have lung, you always have a risk for lung cancer. So no one is immune from having lung cancer. Of course, the risk is higher on patients with history of smoking, former smoker, and family history.
Okay, so are we seeing more men or more women with lung cancer? And then what kind of ages are we talking about when it comes to a lung cancer diagnosis?
Definitely. We're still seeing more men with lung cancer at the moment because of the history of smoking in the mid 20th century. But the number of men who smoke is now coming down. So we really start seeing almost equal number between men and women. And when it comes to younger age, we start seeing more women with lung cancer than men.
Okay, and so what are the signs that we need to be looking out for or paying attention to in our own bodies?
Lung cancer can come with specific symptoms to the lung or general symptoms. So the specific symptoms to the lung are usually cough, coughing blood, chest pain, shortness of breath. These are more lung symptoms. But it also can come with significant weight loss that unexplained, or general fatigue and malaise that no explanation for it.
Yeah, and I think people just kind of pass off general fatigue thinking, it's just the world that we live in these days. So if you are feeling those kinds of symptoms, when should you be going to the doctor and who should you be seeing first?
Persistent symptoms of any kind should really seek medical attention. Usually you start with the primary care provider, and then they will take it from here with referral to a specialist if needed.
All right, just like anything else, there are plenty of screenings and options for lung cancer. So what should we be talking to our provider about when it comes to those screenings?
If you have a history of smoking or you current smoker, you need to talk to your primary care provider about screening for lung cancer. Fortunately, at Cone Health, we have a screening program for lung cancer. There are certain criteria that you look for when you to be screened for lung cancer: age between 50 to 80, history of smoking within the last 15 years, and also 20 back year history of smoking. If you fit these criteria, you can be a candidate for screening for lung cancer. Unfortunately, we don't have a screening based on family history yet, but that's also something that you need to talk to your family doctor about if you have a strong family history of lung cancer.
All right, and what does the screening entail?
It's a low-dose screening, so it's annual low-dose screening. And as I just mentioned, the criteria for the screening, and it's a CT scan of the lung, but with a less cut and low dose. So the expected amount of radiation is much less than the standard CT scan.
Okay, and then let's talk about the importance of early detection.
This is a very good point. We love to see lung cancer in early stage because the survival is so high if we detect it in early stage. Just to remind you that stage 1 and 2 lung cancer have 5-year survival between 60 to 80%. But if we catch lung cancer at late stage, when it's stage 4, the 5-year survival is only 10%. We like to see patients early so we can cure them with surgery or radiation or sometimes additional chemo and immune therapy. We hate when we see lung cancer coming at late stage, which unfortunately 50 to 60% of the patients we're seeing so far come to us at late stage lung cancer.
Is that because they just aren't feeling the symptoms?
Yes, lung cancer at early stage doesn't cause a lot of symptoms unless you do the screening. Unfortunately, when the symptoms start happening, it's usually too late.
This is the part where a lot of people say, well, I didn't smoke, I don't smoke, I have never been around anybody who smoked, so I should not be concerned with lung cancer. And you say that is not the case.
No, this is not the case because, as we mentioned, lung cancer can happen in anyone, even if you're never a smoker. We see a good number of patients who never smoked presented with lung cancer, either because of many factors, radon exposure, air pollution, also work environment factors. So people who work on arsenic and silica dust and many other occupation, including painting, these people are at risk for lung cancer. Even if they don't have these factors, they're still at risk for lung cancer.
And radon gas is one of those things that naturally occurs, and it's here in our state. It's definitely in pockets of the triad, and it's odorless, it's colorless. People wouldn't know that it's in their homes.
True. It's the second leading cause of lung cancer after smoking. And I would say around 40,000 people every year have lung cancer because of radon exposure, and unfortunately we lose a big number of them. Radon testing is available commercially, either by having the kit to be done by yourself, or also get a professional to do the test and also mitigate any factors that is there.
Yeah, and a lot of times you can get a free radon test through the state, so you can check that out as well. In the meantime, when it comes to like that radon gas, so people who would not smoke, a lot of times those are the people that go undiagnosed with lung cancer simply because they have symptoms that they don't think relate to that.
True, and this is the people that we always see in late stage, because most of the time we don't pay attention that they could have lung cancer. It's unfortunately part of us is the medical team that they always think non-smoker don't have lung cancer, and they always look for other reasons like pneumonia, flu, other symptoms, while lung cancer could be the underlying cause of their condition.
All right. What about those people who used to smoke a long time back in the day, or people who have family members who smoke and they get the secondhand smoke? How concerned should they be?
Yeah, former smoker definitely should have they should do the screening test because they may meet the criteria. Patient with family history, especially if you have one family history or multiple family member with lung cancer or other type of cancer, are at risk for developing lung cancer. There is no screening for them, but they should really pay attention and discuss with their primary care physician regarding genetic counseling and also regarding a risk for lung cancer.
All right, in addition to, of course, not smoking, what steps can people take to reduce their risk for lung cancer?
Good question. First thing, if you are a smoker, of course, you quit smoking. If you are a former smoker, you do the screening. The third thing, look at your house for any radon exposure. Making sure that you eat healthy and exercise. These are factors. Also avoid secondhand smoking. Because that's a big number of patients also that we diagnose because of secondhand smoking. So you should avoid that.
All right, just like any cancer, patients are dealing with emotional and physical challenges. How do you help those patients deal with those challenges?
Lung cancer is a serious disease and a stressful situation. So definitely, if anyone diagnosed with lung cancer, we have a great team here at Cone Health to take care of them. But also for patients who think that they may have lung cancer, we have a screening program that can help identify it before it becomes late.
And we've got about a minute left. Let's talk about the disparities in healthcare access impacting those lung cancer numbers. Yes,
we actually have a disparity study done at Cone Health, and we were lucky that we don't have significant disparity between our ethnic group here in town, because we pay attention to everyone, but also disparity is very important. Financial disparity, education disparity, all of these are factors that can lead to people misdiagnosed or come late after their diagnosis with late stage.
All right, thank you so much for your time and your expertise. Maybe you need to send this interview to someone in your family or in your circle of friends. This is going to be in the To Your Wellbeing section of our website.